Friends, in this video authors demonstrate measures to optimize outcomes in pediatric corneal transplants in infants. To perform corneal transplants in infants is a Herculean task. A number of challenges make this proposition difficult. The authors have performed 213 corneal transplants in 178 children, the youngest 2 months old. The first infant aged 7 months had bilaterally operated infantile glaucoma and opaque cornea. One can see the bleb area and dense corneal opacity. It is important to measure the corneal diameter and mark the center of the cornea. The corneal diameter was 13.5 millimeters and an 8.0 millimeters diameter corneal trephine was selected for host corneal trephination. A trephine mark was obtained. Partial thickness trephination was done. An anterior chamber was entered and sodium hyaluronate was injected into the anterior chamber. The host cornea was excised using corneal scissors. Due to appropriate preoperative measures, the intraoperative pressure was normal. We have used donor cornea with 3654 cells per mm square. The donor was sutured using interrupted 10-0 nylon sutures. The first 2 cardinal sutures were placed 180 degrees apart. Then 2 sutures were placed at 90 degrees to the first 2 sutures. Suturing was successfully completed. The graft is clear and the child is enjoying good vision at 3 years follow-up. The second child had severe congenital ocular dysgenesis. They had microophthalmia, microcornea, and sclerocornea. The corneal diameter was 8.5 and 8.0 millimeters. A 6.0 millimeters corneal trephine was selected and partial corneal trephination was done. The anterior chamber was entered and the host cornea was excised. The child had been given intravenous mannitol and hyperventilated, therefore we did not encounter intraoperative positive pressure. The donor corneal button 0.5 mm oversized was sutured using 10-0 nylon interrupted sutures. The child underwent surgery in the left eye 5 months later. She had 1 episode of graft rejection that was successfully treated. The child has started going to school and is able to read and play with her friends. She is able to take part in extracurricular activities. There are many success stories similar to these. To summarize, corneal transplant surgery in infants is challenging but rewarding.